Stephanie Freeman, Memory Center Program Coordinator at Norton Neuroscience Institute Memory Center. Creating meaningful connections. If your loved one has been diagnosed with dementia, it's important to understand the changes happening in the brain and how those changes impact the relationship you have with your loved ones. Maintaining respect and connection with loved ones is the goal for this video and is appropriate for any care partners in a variety of care settings. Dementia changes how we communicate, changing our roles and our abilities. At times, a person with a dementia diagnosis may have changes in personality, behaviors, and emotions. All these things can impact how we connect with those around us. Knowing what these changes are and how to respond can make for successful, positive interactions. If you are a care partner, here are some tips for successful engagement with your loved one with dementia. Focus on what your loved one can do, not what they have lost. For those with a dementia diagnosis, many changes are happening in the brain, yet so many abilities remain. Focus and use those abilities in daily activities. Remember this: when you think your loved one won't do something, it's possibly because they can't. It might not be a choice for them. Focus on the person, not the disease. Yes, your loved one has a diagnosis which you want to be informed, but they are still a valued person with many life stories, traits, and characteristics that make them who they are. Know these stories. This will help you to engage in activities or conversations which will be meaningful for both of you. These activities and conversations may look different than before, but adapting to your loved one's current strengths and abilities can result in wonderful interactions. Slow down in your actions, your speaking, and responding. It can take up to 10 seconds for a person with dementia to process what you said before responding. Also, we are so busy and quick to complete tasks that this can be overwhelming for someone with cognitive impairment. Let's be honest, a little slowing down is good for everyone. Have realistic expectations. Not one person has this disease figured out completely. Gather information and make plans, but be realistic in your loved one's abilities, and also be mindful of your own abilities and limitations as a care partner. Have humor. Respectfully, of course, but you can change a stressful situation into a positive moment by finding an appropriate way to use humor with your loved one. And support the need to feel purposeful and useful. Feeling needed is so significant to living. This doesn't change because a person with a dementia diagnosis needs more help than they did before. Being creative and using their skills and abilities is such a dignified way to live with this disease. A person with a dementia diagnosis is doing the best they can, and so are you. For more information on the NNI Memory Center, please call 502-394-6460 or visit us at nortonhealthcare.com/memory center.